All right, so we're gonna go ahead and get started. I think people will still be coming in. We have a few delays today, but just so we're on schedule. All right. So hi, everyone. Thanks for joining today. Good morning, good afternoon, good evening, depending on where you're joining from. We're happy to have you here for this writing workshop on digital health futures. My name is Adriana Bankston. I'm currently the CEO and managing publisher for the Journal of Science, Policy, and Governance. For those of you who are not familiar with the journal, we'll share our website in the chat. And I'll give a brief background on JSPG. So we are an internationally recognized open access and peer-reviewed publication. We cover every corner of science and technology policy and focus specifically on publishing work from students, postdocs, policy fellows, and early career researchers in science policy. You can find the criteria for submission on the website. And through the journal, we bolster their research and writing credentials in science policy and encourage them to engage in policy discourse and debate. So we are more than just a journal in terms of trying to foster professional development and training and writing and editing, publishing, as well as a number of events such as this workshop and webinars through which we think through training the next generation in policy. In terms of our publication formats, we publish a number of formats here. As you can see, OPEDs, technology assessments, policy memos and analyses, white papers, book reviews, workshop proceedings, and other research articles. So these sort of shorter, longer versions, research papers on a number of different topics, which are on the screen. Highlighting a few of these, you can sort of see health and other ones that are relevant to today's workshop. And as I mentioned, we organize quite a number of events and promote also our published work through our newsletter, global mailing lists, as well as webinars with speakers that I'll talk about what's coming up for this issue. And we're also on all of the social media channels. So you can see the Twitter at the bottom here, but we're on Twitter, Facebook, and Instagram. And also we have a YouTube channel where we post all of our recordings. We'll post this as well. And so we encourage you to go there for content on science policy that we've had in the past. So now I'll move into the call for papers and why we're here today. So we launched call for papers on strengthening youth-centered policy and governance on digital transformations in health. The deadline, this will result in a special issue. The deadline is August 21st. And we're accepting articles on a variety of formats. You can find this at the website bit.ly/JSPG Health Futures. And the special issue is sponsored by the Lancet and Financial Times Commission on Governing Health Futures 2030, Growing Up in a Digital World, or GHFutures2030 for short. And it is centered on a recent report that we'll hear about soon, and we'll share the link to the report as well. So leading up to the submission deadline, this is our writing workshop, providing opportunities to practice writing policy papers on digital health topics. We're focused specifically on topics that are in the upcoming webinars in July, and those will help with high-level discussions with experts in the field. So we encourage you to sign up for those. Details will be available soon, but you can register now. And again, this workshop is very hands-on, sort of practicing policy writing. So you can see the schedule in the chat. We'll have an introduction from our GHFutures2030 partners. Then we'll have a presentation, talk a little bit about policy writing, and then spend the rest of the time going into breakouts. So with that, that's really all of my introduction, sort of early, but now I'd like to switch and introduce Whitney Gray, who is the Policy and Research Officer and Youth Coordinator of the Secretariat of the Lancet and Financial Times Commission, which is hosted at the Global Health Center. She graduated from the Graduate Institute of International and Developmental Studies with a master's in international affairs where she majored in sustainability with a focus on global health governance. And she has a variety of experiences related to health, health for all, including around diversity and governance and health policy. So I'll let her tell you more about that as well. Thanks for being here with me.
Thanks so much, Adriana. And just to say a big thank you to JSPG. It's been a really great pleasure working with them. So we're very excited to be here. I'm joined, of course, by Rohinton Midora, who is a commissioner, and he will be doing kind of the opening presentation about policy writing in general following the opening. So we'll look forward to that. And then we also have a few people joining from the commission throughout the next 2 days. So hopefully you're able to kind of talk with them on a more personal note and get to know the commission a bit better. But just to start off, if you go to the next slide, I know our commission is quite a mouthful, so we shorten Governing Health Futures Growing Up in a Digital World. It's short with GHFutures2030. We were established back in 2019 to look at the convergence of digital health, AI, and other frontier technologies with UHC and the attainment of the SDGs, specifically around goal number 3, and in general to improve the health and well-being of young people and children. You can see here we've got a little model that we started with when we were working, and you can see the values that we have around equity and human rights, the ultimate goal of will it allow future generations to flourish. And the whole objective of a commission, I'm not sure your level of familiarity with it, but it usually runs for a couple of years with the ultimate goal of producing a report with very clear and sometimes bold recommendations on the tasks that were assigned to kind of the commission. Next slide, please. So this is the Great Commission. It's kind of important to realize the separation between the commission and the secretariat. The commission is what kind of the driving force behind the commission report itself. So it was led by 2 co-chairs, including Alona Kikbush and Dr. Anurag Agarwal, as well as 17 other commissioners that represented a vast and diverse group of people and experts from around the world. Some economists, some public health, behavioral scientists, policymakers, tech people. So it was really a great group of people. I had the privilege of kind of meeting them and learning about some of their work and how they fit into the commission. So that was really a great experience. I think one thing that set us apart from other commissions is, of course, our name. It kind of implies this, right? Is the Lancet and Financial Times Commission. So having that private sector inclusion was really great for us because of our focus on the digital technologies and innovation for the future. Next slide. So here is the report. It was published in October of last year in 2021. And you know, this report, it's really, it was an amazing adventure, I would say, because it started right when COVID hit. So we were really pushed into the digital world. We only met once in person. Everything else was completed online, which was, it was really amazing, actually, to be honest. And we actually were able to do a lot of things with young people and different stakeholders that we maybe not would have been able to if it would have been all in person. So I think that's quite important to mention. And the report itself, I hope that you guys were all able to share it. I know Adriana has shared the link. But it's really quite a bold report. It focuses on a new vision for governing health futures, and it took into account a lot of young people's ideas, imagining health futures, kind of surveys and polls, and then just research in general from the commissioners themselves and their connections. So it calls for a radical rethink of harnessing the power of digital technologies, and sets out a new approach for digital transformations that promote equitable, affordable, and universal improvements to health. Next slide, please. So here are the 4 key recommendations of the report. Address the role of digital technologies as determinants of health, build a governance architecture that fosters trust. Number 3 is govern health data to increase its public value. And number 4 is invest in the enablers of digital transformations for public health. That's kind of where it brings us now to JSPG Special Edition. You'll see that we chose to really focus this edition around digital determinants of health. So number 1, around the digital technologies. And then kind of a combination of 2 and 3, which is around fostering this trust architecture, data solidarity, and what that means to young people. So really the report recommendations has completely framed what we plan to do in this special edition and what we hope to kind of hear from young people in their own right, in their own thinking about what this means, where policy needs to go, where more research is needed. And that kind of brings me then to the next slide, which is, I think it's always important to see it in a larger framing. It's great to talk about where we've been, but hopefully also where we're going. So the commission is to end in June of this year. And the goal is to then start a digital transformation in health lab. And that will run from January of next year until 2030. Again, you'll see that the 3 main work streams aimed at improving young people's health and well-being is around advancing a value-driven approach to digital transformations in health, putting young people at the center of digital-first health systems, and addressing the digital determinants of health. So these 2 day-long workshop alongside the following 2 webinars in July will really look at the pink and the blue, right? So the digital transformations in health around trust architectures, data solidarity, a value-based approach to health, as well as addressing the digital determinants and what that means kind of to young people and of future generations. So I will leave it there. I'm happy to have any more questions or comments. I really encourage you. I'll post a few links following this presentation to join the youth network. The report's already been shared, but I can also share some links to the executive summaries, the youth edition of the report, other kind of outputs and helpful links that maybe you might be interested in. But just to say that we're really happy to be here. We're very appreciative of your time on this lovely weekend. And I just hope that you enjoy yourself and we get some really great productive outputs and conversations from this discussion. Thanks so much.
Great, thank you for that introduction. Very helpful background. So before moving on to our main speaker, I'll just pause for a second to see if anyone has questions for Whitney. You can enter in the chat or unmute yourself to ask. Okay, not seeing any right now, but feel free to reach out again. Go to the website, follow them on Twitter. We can discuss more also if you review the report too. Great, thank you. All right, so now I'd like to introduce our main speaker for today, Rohinton Midora. He's the president of the Center for International Governance Innovation and also GHFutures2030 Commissioner. Previously, Rohinton was Vice President of Programs at Canada's International Development Research Center. He also serves on a number of boards, including the Institute for New Economic Thinking and the McLuhan Foundation. He received his doctorate in economics in 1988 from the University of Toronto, where he subsequently taught for a number of years. And in addition to his PhD, he earned his BA and MA at the University of Toronto, where he majored in economics. He published extensively on, on these issues and produced several books. So we'll place his bio in the chat so you can learn more about his background, but keep this brief, and thank you so much for joining us today, Rohinton.
Adriana, thank you. And Whitney, thank you for having me. I think the plan is that I'll speak for about 10, maybe 15 minutes on the topic of sort of writing impactfully for policy, and then we can move to a conversation. I guess I'd begin with the obvious, which is if you look around you, both in your community, in your country, or even globally, the kinds of big issues that we face, pandemics, climate change, financial sector instability, digital technologies, the conquest, if that's the word, of outer space, they all have a strong science and technology element to them. And yet the solutions don't lie just in science, but they certainly lie in understanding science and making people who are not scientists understand science. And so that's in many ways the challenge and the opportunity. That's what motivated our commission in some ways to link new technologies with, which is a new issue, with an age-old issue, which is global health and the future of youth. And so I'm going to sort of just make 7 perhaps statements or things that I've come across in my career that might be helpful when it comes to sort of presenting science for different purposes. And the first one is exactly that, is what is the purpose for which you're writing? Writing for your science peers is not the same as writing for the general public to alter some kind of behavior. And that in turn is not the same for writing to change policy. Policymakers absorb information and act differently than the general public. And our science peers absorb and act differently when it comes to information. And so knowing your audience is important. You have to know why you're writing and who you think your target audience is. And then, cater to your audience without compromising on rigor. So it's one thing to write effectively, it's another thing to pander. And it's very easy to see the difference between the two. And the best writing is writing that speaks to some people and perhaps not to others. And that's okay. If someone says, your piece is a great policy piece, but it's not going to change the average person on the street's behavior. If that was your intent to write to policymakers and not change behavior, that's fine. If it wasn't, of course, you have an issue. But I think my main point is know our audience, and audiences can be segregated every which way. It can be by their profession, by their culture, by where they live in the world, what stage in life they're at, and on and on and on. And so there's a marketing element and a demographic element to writing, which has to be your starting point in some ways. Second, we distinguish between output, influence, and impact, right? When you write a paper, that's an output. And as happens in universities, if you write 17 papers in a year and you say, I wrote 17 papers and 5 of them were chapters in a book, those are all outputs. Then the influence they have has to do with, how many people kind of read them and absorbed them, maybe shook their head, maybe were motivated to do something. And it's that doing something that's the impact. And that sort of sequence is worth keeping in mind. We're very good at measuring outputs and sometimes influence, certainly in the academic world, but increasingly in the think tank world. We use bibliometrics, and bibliometrics tell you at any point in time a number of things, how many people read your paper, where it was cited, how many minutes, if it's on the web, people spent reading your paper, and on and on. But bibliometrics are only one part of the puzzle. Bibliometrics in and of themselves are not enough to tell you about influence and impact. Increasingly, for that, you want to use social media and other kinds of messaging. And so this is a point I'll come back to, which is a paper is not just a paper, it's other things as well. But broadly speaking, the academic world is good at demonstrating bibliometrics. While if you're in a think tank or if you're in an advocacy NGO or somewhere where you want to make change, telling that story is really about relating how a process happened which led you to a certain outcome. And so that brings me to my third point, which is the process. One of the most important things to look out for or to know is that, and I mean, I'm sure you all know this, but let me say it anyway, I faced it all the time, is the attribution problem. When you find yourself part of a change movement, it's very difficult to pinpoint change to any single person or group, much less any single paper. Papers by themselves are not influential. Papers are influential when they feed off each other and become a body of knowledge. Papers are influential also when they hit a certain zeitgeist. But in and of itself, to say, my paper resulting in this change is a big leap. And it's okay if you cannot make it. What you want to show is that your paper was part of a movement that perhaps made some influence and impact. And I'd say that about our report as well. I mean, the Commission report is a very good report. It's been published in the leading global health journal in the world. And we have as our second partner, the leading economic policy newspaper in the world. But what matters then is the concentric circles that emanate from that report. And that is a whole different field. And in the end, if, for example, one of our recommendations to see data through the lens of data solidarity, if that picks up, it's not going to be just because of the report, but a series of things around it as well. And again, I'll come back to that. And so that brings me to my fourth opening point, which is to be patient. Sometimes it takes a very, very long time for writing and a body of literature to have an impact. Think about going back to the 50s when we began knowing that tobacco was harmful to health. And think about when the first really meaningful steps were taken to either change packaging or ban advertising or raise taxes because it's seen as a so-called sin good. There were decades in between, and we're still not there. Sometimes having the evidence is not enough, and it takes time for the evidence to feed into policy. In my country, in Canada, one of the examples we often use is that we've known for 50 or 60 years that daycare and taking care of children and early childhood development policies have economic benefits. They're not just good, but they also have economic benefits. That hasn't translated into any meaningful policy action in social policy, even today, even though we have lots of commission reports, lots of evidence. And sometimes that's just the way it is. That doesn't make the literature unconsequential, doesn't make it wrong, doesn't make it irrelevant. But it does demonstrate the importance of persistence and of staying with something and then knowing when to seize the moment. And so then I'm going to end with 3 points that have more to do with the practical aspects of writing. The first one I'd say, and you know, I'm old enough to remember a completely different era, unlike most of you, but data visualization has grown in leaps and bounds. The example I'd use from the pandemic is the website, the portal ourworldindata.org that is curated at Oxford University. And it is now seen as the standard go-to site in many ways for some of this. NASA maps from space are attributed often for having raised public awareness of climate change. And so an image, maps, dynamic mapping are tools that absolutely are part and parcel of impactful writing. And I think it's important to understand that that's part of communication. At at the think tank where I work at CIGI, when we often do an essay series, we embed in it short videos that are explainer videos or 1-minute interviews with the authors. And that's a very effective way of communicating. One of our most effective tools of communication was an explainer video we did some years ago with animation to explain blockchain technology. And it, received more hits than the best paper we could have written on blockchain, and has been more influential in sort of sensitizing people to what the pros, what the challenges and opportunities with blockchain are. And so multimedia, data visualization, new techniques in portraying information, all absolutely crucial to a paper. If you see a paper as just a paper, I don't think anymore it cuts it. Sixth, it helps if you allude to a concept that people can relate to. One of the examples I give, and I think I've sent this as one of the background readings, is when my colleagues and I talk about the importance of digital governance and the importance of governing new technologies, we often call for a Bretton Woods conference for the digital era. And not all of you have to know what Bretton Woods is, but for those of you who do, it kind of lights a spark in your mind. So the Bretton Woods Conference, which was held in 1944, was a conference among many countries, mostly the victorious ones towards the end of the war, to design the economic arrangements that govern us still. And it is through that conference that we created the International Monetary Fund, the World Bank, and eventually what we now know as the World Trade Organization. The global economic rules of the game were created then and endure to this day. And so Bretton Woods evokes this sense of gravity. It evokes a sense of many important players coming together, negotiating, and coming up with rules of the game that endure over time. And so when I said, we need a Bretton Woods for the digital era, right away you sort of get the picture. You get the picture of what this is about. This isn't about a law here and a regulation there. It's about a very fundamental rethink of how we want to shape the world. And so those kinds of allusions, I think, are important. The other one that's often used is moonshot. Professor Mariana Mazzucato in London uses the phrase moonshot to describe how countries should design their innovation policies. The point being, you set yourself a target, a very ambitious, captivating target, and then you use all your resources to get to it. And that's the moonshot analogy. And then the last point I'd make, the seventh one, is the one I'll end on, which is see your paper as a process and an ecosystem. By process, I mean publication of the paper is not the end of the story. How you then disseminate it, whether it's through breakfast meetings, whether it's through social media, whether it's through other forms of creating creative visualization, is all part and parcel of publication. And so having a strategic timeline around all of that and seeing the paper as a strategic tool that's one step in a process is important. And so the point about ecosystem, a paper by itself is not going to do the trick, but a paper along with all of these other things is going to help you get to your goal. Paper writing is important. It's a necessary but not sufficient condition for success. It is necessary, and that's what I mean by process and ecosystem. So Adriana, I'll stop with those few thoughts, and I'm happy to keep chatting for a bit.
Thank you, very helpful. Yeah, so to kind of frame this a little bit in the context of the journal and this call, we emphasize quite a bit the educational value of paper writing, which you mentioned towards the end, sort of, learning how to refine the argument. We try to provide sort of training in writing and editing. But as you said, and of course, because we're an online journal, so we don't want to just be a PDF online that nobody reads, really thinking through how do we make this impactful? How do we get these ideas out there? You mentioned interviews. We have a podcast. That's something, we're sort of trying to do interviews with authors to get a little bit out there. And then also a lot of them, write for policymakers at different levels, either state, federal, or sort of international, calling for changes in legislation and so on. So we're really trying to leverage this into actually reaching policymakers. And we've had recently a few students actually come to DC and talk to their representatives about their paper and sort of larger issues. This was around sort of remote work and equity with the pandemic, which makes sense. But we'll do more of that, but there's a lot of interest from young people to get their ideas out there and really make an impact with their published ideas, which again, I think they're new and interesting. How do you sort of see this question of impact in policy? You kind of touched on this, but what do you think impact really means, and how they might be able to actually leverage some of their ideas to make an impact? That's the first question.
Yeah. No, I think it's a good question, and it's a very good opening question, because if you don't know what impact you're looking for, then you're kind of not there. Impact in policy is usually designed as a policy change and a policy improvement. And I think the biggest challenge there is how incremental you want to be. Clearly, in an ideal world, all the policies that are needed to effect a change would happen at the same time. So if you have a once in a lifetime pandemic that hits you, you and I could list the 5 or 10 things that should have happened right away. Science should produce a vaccine. It should be priced and distributed in a way that everyone gets it right away because of the spillover, the positive spillover effects that comes from inoculation. Global IP rules have to be adjusted or revisited because of this, and we learned that from the AIDS crisis as well. Country innovation systems and manufacturing capacity, what we used to call industrial policy, has to be altered in a way that incentivizes this. And on, storage facilities, logistics. In practice, that's not what happened. It would be nice if everything happened at the same time, but in practice, you go for second best. And so you have to sort of slice this and understand which bit you want to work with first, and then take it. And I'm not making a case for complacency. I'm not trying to defend the status quo with vaccines at all. I think it's an abomination, actually, what's going on with vaccines. But I'm simply making the point that if at the start of the pandemic, you had defined impact as everyone having access to vaccines and changing their public health habits and wearing masks and washing their hands instantly, then that's not realistic. And so you have to choose which ones you go for first.
Yeah, and I think the pandemic, I think it's a good example to something else you said about seizing the moment, right? So, we've sort of framed some of our issues around this and how the pandemic has impacted different areas of policy, trying to sort of be really relevant to what's happening today and what students are thinking about, especially how education is impacted and a lot of things around higher education. So I think to that effect, what would you say to, authors who are interested in submitting to this issue, sort of in terms of being relevant with issues around digital health and making that impactful, right? So within sort of where the field is now, can you talk a little bit about maybe challenges of making this impact, or if you have any lessons or examples of successful impact, right? What that would look like, as I would imagine that, they'll submit if their paper gets accepted, they'll want to then kind of take that further. And, we're trying to provide these resources for them in terms of background, but what do you kind of see as a timely impact that's relevant to what's happening today in the field?
Yeah, look, I guess I'd say it's good to have a thick skin, because there's some things you can control and some things you cannot. No individual can control the zeitgeist of the moment. So, if you've been working on pandemics for years and years and no one's been listening to you, and then a pandemic happens and everyone turns to you, good for you. But there were all those years when you were in the wilderness, right? I have a colleague who works on privacy policy. She's a lawyer and she's a fellow at my institute. And she always makes the point that she was doing this for 25, 30 years and no one paid attention. And once the whole Facebook and all this other stuff began happening, the media's after her, everyone's after her, and her field became hot. And so the point is, don't try and select your field based on what you think will be hot. Select your field based on what interests you, what you want to do. Keep doing it. But when the moment comes, seize it. So that's my point about the zeitgeist, is be ready for when it happens, but don't think that you can create it. And if you're okay with working on something that's not caught the public eye, that's fine too. The smaller sort of spheres within which one can be influential. And so not everything has to be a global problem to become important.
Yeah, I think, and that's something we, think about at the journal, because we want to highlight sort of early career ideas, and really kind of what the young people think the future of the field is, but also keeping in mind sort of what is relevant today, right? So you don't want to necessarily write about something that happened 50 years ago that no one cares about now. So there's that balance of, bringing the ideas in, kind of what you're saying, follow the interest, write about what you're interested in, but maybe keep it relevant also. Yeah.
In our commission, even in the 2 or 3 years that we were together, I'd say when we first met, and Whitney might recall this, we talked about data governance as being one of the building blocks for global health and new technologies. And it's kind of okay. But even in that period, we've suddenly seen, boom, how everyone's concerned about big data. Everyone's concerned about your privacy and where your data is used and who's using it. And that's kind of changed the nature of the issue. Frankly, not because of anything we did, but some of us certainly could say, well, we had the foresight, maybe, but at the end of the day, it's something quite different that drives. I mean, the wind comes from anywhere. What you're doing is seeding the wind.
Yeah, that's a really good way to put it. I think, and so I mentioned, a lot of our authors write for sort of their local policymakers. Ways, I guess, one other question, kind of how you can impact different stakeholders with these papers, right? So I would imagine most of them sort of like write for a policymaker that they're maybe is interested in this. How would you sort of connect your writing with different stakeholders, like whether it's the public or policymakers? Do you have sort of ideas about bridging that gap?
This is where being part of, I'll just call it a good institution helps, meaning no single person on his or her own can communicate with different kinds of, some people can, great, but most people are good at some kinds of communication, but not others. And so if you're part of a team, and if you have a good communications group, then I'd much rather see this as a team effort than see this as one person. Some people are incredibly good at writing for their peers. They know the lingo, they know exactly the literature, they can cite it, and that's great. But they're not necessarily the people you want to put in front of a policy breakfast, for example, or in front of a congressional committee, and vice versa. And so being part of a team means that not everyone has to be good in everything, but the team should exhibit all the characteristics. And I'd say increasingly it's becoming clear what those might be. First and foremost, and that speaks to the value of academic journals like yours, is you have to be taken seriously by your peers. If you're not, if other economists don't think you're a good economist, or other physicists don't think you're a good physicist, then you're not going to have the traction, or you don't deserve the traction. So that's number one. Number two, understanding what drives policy actually involves a quite nuanced view, and that change differs by country, it differs by region and country. I mean, even in my country, the way policy works in one province is not the same as it works in another, or one city versus another. So knowing what makes that policy process tick and then working with it is a quite different skill. And as I keep coming back to this of the glad handing and the breakfast meetings and so on, but looking people eye in the eye and telling them about the issue is much more important than sending them a paper and saying, read it. So influence in that. And then the third dimension, which I refer to, is public behavior. So when it comes to things like tobacco use or masking or healthy or unhealthy practices in daily life, it's about education. It's about op-eds, it's about public media, and ultimately it's about curriculum development in schools. And so there's a range of things you want to do to promote good citizenship. And you go, that's really far from writing a paper for a journal. True, but it's that spectrum of things you need to do to make change.
Yeah, definitely agree with that. And also that I think we try to use what we publish for educational purposes as well. So not only what I just mentioned, sort of helping the authors hone their argument and learn through that process, but also then using the published ideas for education, right? If it's vaccines or things that you were saying before, can use sort of some of the, actually we've had a couple of schools that actually used our publications in their class. So, that idea of this scholarly knowledge, right, can be useful for actually teaching policy or, what's sort of relevant. That's just a sort of.
But kudos to you, because I'm guessing most, certainly the academic journals I know, have no intent or group that's of try to translate that into curriculum development and classroom use. And if you're doing that, you're way ahead of the game. That's great.
Thank you. Trying to be, yeah. Okay, so then last question I had, we get this question a lot from students about, okay, for example, I'm interested in digital health. Where can I find information? So obviously this is different from sort of the academic writing. There's no PubMed. They're used to writing sort of research papers on their bench research, but obviously in policy, I think there's a lot of places where, as we've already shown, there's reports and other links and places where you can read about kind of what the field is. Do you have specific recommendations for resources when they're writing about these topics?
Recommendations on what, Adriana? I didn't catch that.
For references or kind of where to look for background on digital health, any resources like that. Yeah.
I mean, Google is the biggest boon and the biggest bane when it comes to, when I was in graduate school, we literally went to the library and thumbed through index cards in the library. And clearly anything that helps you digitize the access to information is a good thing. But I do think that the plethora of information we now have requires you to filter. Google is one filter, but it's not the only one. And this is why when I do a search, I don't stay on the first screen or the first 1 or 2 recommendations, 5 or 10 recommendations. I often go to page 5 and page 17 and page 25 or 700 just to sample what that tail off looks like. And you can then get a good sense of how that algorithm has been programmed and what it's giving you as priority and what it's not giving you as priority. And it may be that your priority is what it is not giving you as priority. And so, use Google, but be skeptical of it, or use it to its full extent, I guess is what I'm trying to say. I should say, and I don't know how you feel about this, but I have found that the quality of information on Wikipedia has greatly improved. Now, I still, through my institution, subscribe to some traditional encyclopedic databases, and I still find that that's helpful. And certainly services like Oxford Analytica and so on are important. But I think that Wikipedia shows what a movement can become over time. And I think that's useful. The other thing I'd say is increase. Obviously, I would always tout the think tank world. I think some think tanks, not all, do a very good job, or at least put resources in creating public education databases. And the one, I won't tout my own, but I find that the Council on Foreign Relations, for example, has explainers on a range of topics that go beyond foreign relations, which have great academic and public educational value. And I think think tank websites have become a source that they weren't 10 or 20 years ago. There's a database on drone warfare, for example, that a think tank in Washington, I forget which one, will come to me in a second, runs. It's the go-to source on it, but you have to know that it exists. And so if you do some digging around it, you gravitate there. And then final point, obviously, you should learn how to understand what that source is. So if it's an industry source, doesn't mean it's wrong, doesn't mean it's bad, but understand that it's an industry source. If something's an NGO source, that doesn't automatically make it good. NGOs often produce shoddy work or are more interested in advocacy than in the rigor of what they're presenting. Understand that. That's all. But I think the web now gives us a set of access to information that we don't have before. Final point is increasingly the best governments put just about everything on the web. And so department minutes, minute regulations, budget line items are hugely important for basic research.
Yeah, that's very helpful. And we'll definitely encourage folks to read the report as well. And as I said, we have these couple of webinars coming up with experts in the field talking about these issues. So again, they may have other recommendations as well, but that's sort of why we do these webinars also, because we want to invite folks like you who are experts and can sort of give the background, talk about the field, and encourage students to get their ideas out there. So sounds good. Well, thank you for that. Go ahead.
All the best. No, I was just going to say thank you for having me, and all the best. I look forward to seeing what comes of this all, what impact you will have. Exactly.
Yeah, we'll share the issue with you. Yeah.
Great. Thanks.
All right. Thanks again for joining us today. Have a good weekend. All right. Okay, so great. Glad you enjoyed that. Yeah, I encourage you to look at the links that we shared. Rohinton also shared a couple of articles that are in the chat, which can be good background for these papers as well. So moving on to our breakouts. Let me get my notes here. So what we're going to do now is have you work on paper outlines for this issue. We have a few questions we can ask sort of to help you frame the argument. And we'll have a few moderators who will help you sort of frame the discussion as well. So I wanted to introduce them now. And if you all would like to say hello. So room 1, we have Sharmi Hack. I'm gonna say hello, Sharmi. Sorry.
Hi everyone, I'm Shami. I will be moderating breakout number 1. Very excited to hear how your ideas will develop, and of course me and Christian will be here to navigate any conversations that you may have difficulty having, and we really look forward to hearing your ideas and developing them further.
Thank you. Room 2, we have Saif Elhan. Saif, can you say hi?
Yes, absolutely. I'm going to turn on my camera in a minute. Hi, everyone. Very glad to be here. I'm a regional youth champion for the Commission for North Africa and West Asia, and I'll be moderating the topic of governing health data to increase its public value and foster trust. Glad to be here.
Thank you. And then room 3 is similar to 1 in topic. Sridhari Govind.
Hey guys, I will be moderating the session. I think I'm very happy to be moderating the session, at least in the breakout room 3. I'm sorry, can you hear me?
Yeah.
I hope so. Okay. I'll be doing on addressing the role of digital technologies as determinants of health, and looking forward to engaging every one of you.
Great, thank you. Yeah, so as we said, so we will focus on 2 topics: addressing the role of digital technologies as determinants of health in rooms 1 and 3. And then room 2 will be governing health data to increase public value and foster trust. So we'll do this for about an hour or 45 minutes or so, and come back and recap. Julianne, can you share the breakouts document? Thank you. So moderators, you all are co-hosts, should be able to share your screen, take notes. We'll ask you to help go through the questions, and then we'll come back and recap after that. So I'll be in the main room if anyone has questions, but I'll let you all go to start working. Thank you. Okay. All right, so then there we go. Okay, so now we'll do a little recap. So you all were taking notes, really interesting ideas from what I could see. So would love to hear a recap of your room and takeaways, a few things, how you kind of went through the questions. And starting with Sharmi.
Yeah, that would be great. Thank you for that, Adriana. So we had a very fruitful discussion with Asalata and Alyssa. So we've notified our title as Digital Health ID, Bridging the Digital Divide or Jumping the Gun. So Asalata was really discussing about the use of health information as a result of the COVID-19 vaccination rollout, and how the government has already acquired a lot of the data from its public without consent, which obviously is a breach of the human rights, and we will delve into that a bit more. Health records need to obviously be accessible by the individual, and obviously because of the internet access, which is extremely varied in both rural and urban parts of the country, as well as health literacy is extremely varied as well. So we identified the key stakeholders here: it was the Ministry of Health and Family Welfare, the Ayushman Bharat Digital Mission, and the regional powers also having some governance over that as well, pushing for the digital ID. The digital ID itself is sought under the Aadhaar Unique Identification Program, and these are biometrics linked to the demographic. So we really tore apart this problem and really tried to understand how getting information rapidly from the Indians about their health and the potential abuse of information across data measures as well, giving it susceptibility for misuse, both in disinformation, misinformation from governmental messaging. The questions arising, well, who is going to be using my data? Is my data safe? And what is being done to make that data accessible to people that will need to use it? So we really looked at understanding digital health transformation to be articulated to the public, to make sure that they know that their information is safe and secure and ensure streamlined services. We outlined taboo areas as well, so that having that level is also not knowing data is safe and what can be done about it, especially patients not wanting to may avoid treatment as a result, especially for young women. Mental health as well, actively seeking mental health issues, and the government already having that information has implications, and that could be quite a topic for discussion for young people, especially in areas of sexual health, reproductive health, which causes barriers to accessibility to health. In particular, insurance companies may also raise their rates, and again, providing barriers to health access. We also went into a bit more discussion on the opt-in, opt-out wasn't really even something that the public really had access to. So having public health confidence in the government to understand, well, this is what has already been done. How can the public navigate it and the individual navigate their data and be given informed consent on who actually uses that data? So it goes back and pivots back to the individuals having autonomy over their data. And seeking authorization from the individual to access that data, and also selling it to the public that this is obviously going to be a way of improving the quality of their healthcare service that they will receive. So we pivoted on two or three policy options. So looking at India's data protection, so that's been currently debated in Parliament, and the way that the individual will access their own information, and then understanding what government is going to be able to do, provide the right education for digital health literacy and giving that public health messaging in the right language, in the right context, especially given the literacy levels are so varied in India. So easy to link other policies for improving digital access in India, making use of governmental centres to kind of alleviate the absence of internet access. Implementing programs in place for rural areas, community centres to help infiltrate India's huge population, which is a large problem as well. So inevitably, this is a push in the direction of digital transformation. However, exemplar countries such as Canada, India could learn from, especially health data protection, personal data protection, so privacy rules, protecting privacy of protected health information, setting limits and conditions on the uses, and making patients have a right to receive a notice explaining how the provider or the health plan and discloses that health information, and also linking that back into enabling and advocating health literacy amongst the population also. So I will summarize on that end. Aslata and Alicia, please feel free to comment or add anything that you may have felt that I've missed. But it was a very fruitful discussion, so I was very excited to have had that discussion with you both.
You covered the ground, Shami. You covered all the points we discussed. Thank you.
Great.
Feedback from
Yeah, thank you all. Looks like a lot of great content here. Like how you brought up the autonomy of the data, that's something we'll talk about, and also literacy for sure is a big question. And as I said, we'll discuss some of this in the webinars also, so feel free to sign up for those. But great start of a paper here for sure. Thank you. Okay, so let's go to room 3 now, since you all had a similar topic. I think it would make sense to follow that up, and we'll go back to 2 if that works for you guys. So Srihari, can you give us an update? Okay, actually it looked like he dropped off. Anyone else who was in that room that can report out?
It was only me actually, because the other person left. So I'm not prepared for this, but anyways, what our topic was about, what we pointed out was about accessibility. So we work on that, basically on discussing what were the main things so that everybody could have access to digital technology. We point out that as like in every country, not only in, for example, I was explaining in Latin America that there is accessibility is not for everybody in terms of digital technologies, but you can also think in Canada too is the same thing in terms of the native communities. They don't have access, so many of them don't have access to digital technologies. So accessibility is for everybody. And also we talk about, for example, people that have some disabilities like video, audio, or So accessibility is it's a big subject, right? So we talk about that. We also talk about how we could tackle this problem about accessibility, and we thought that we should begin by trying to get the attention of governments in terms of investing, right? Investing on digital technology so that people would have access. And investing in digital technology, we thought it was an important point to get to schools where at the very young level, people will have access to digital technologies. So yeah, basically that was the main subject, was accessibility, how to tackle it through investment. And once the infrastructure is there, then we need to promote it, and then we need to adopt it. But the first step was to get the investments for the infrastructure to get to that digital technology to everybody.
Great, very helpful, and I'm glad you brought that up. It's interesting too, because I imagine we'll have these discussions in the webinars also, kind of what this looks like in different countries. What was already brought up, sort of the literacy, the accessibility, I think is a big part of this anytime you have technology. And I've certainly seen that too with the pandemic, and there's a lot of questions about how to make technology more accessible and all of that. So very good discussion, thank you. All right, so let's move on to Saif, room 2. So you had a different topic, but excited to hear your recap.
Yes, thank you, Adriana. So the topic that we had was governing health data to increase its public value and foster trust. So I'll start with the title just to give a quick snapshot of where we landed. And mind you, we added working title because we think that the name and the title should always be more catchy, but this is just descriptive for now. And it's called Holistic Framework for Safeguarding Health Data. So what's the problem to be addressed? The problem is that there's an inherent lack of trust when it comes to the possession and utilization of data, generally, but specifically health data. Hence the need for an effective governance framework to facilitate this trust. And this trust in itself is needed to unlock the value that the data can offer in providing healthcare. So essentially, that's the problem: is how can we facilitate that trust? And of course, you can tell that from the title. The solution that we landed on is the framework. Who are the stakeholders involved? So we identified more than 3. Of course, patients and citizens are 1. Government and regulatory agents is a second. We identified private sector, of course, healthcare institutions, third-party data users, and then lastly, there was an important mention for patient advocacy groups. So these are entities that sometimes can come in and fill in the gaps that are really needed and pushing the right conversation forward. Which stakeholders should act on this problem? We highlighted government and regulatory agents as 1, and second is patient advocacy groups. This is not to suggest that private sector does not have a role to play, but we don't want the private sector to be the one who has full agency to dictate how this goes. We want this to come from those whose interest is to safeguard the public's data, to then the private sector can engage and react, but we don't want it to be prescriptive from the beginning. What's the current landscape in this problem? So actually, this was partly inspired by what happened with DeepMind, which was acquired by Google. It handed over data, more data than was originally agreed with the National Health Service, NHS, in the UK. And the suit is still pending. So that's the current landscape, in the sense that the industry norms are still being defined. Also based on the lived experience of the practitioners that we had in the group, it was highlighted that the consent of the patients regarding their data is still not streamlined. And the sort of that tidbit was the starting point for how we thought about putting the framework together. So the consent of the patient is not streamlined, and it's not sort of within a clear, centralized process that's also uniform across different jurisdictions and institutions. And when we say clear for both practitioners as well as the patients themselves. So the former knows how they're going to be held accountable, and the latter knows what their rights are. And then number 3, also highlighting that we want that consistency to happen across borders, including developing economies. So the two policy options that we landed on, number one was the holistic framework that I mentioned. And this is for the entire value chain, from data pseudonymization to data collection, storage, processing, etc. The second one is then having a policy or even government law that criminalizes the oversharing of health data, since it's that sensitive and that's that necessary. Now, why we chose to focus on the framework is not necessarily because it has more merit. It's just that chronologically, one needs that framework to come first and then be able to hold institutions accountable. So that's where we landed. In terms of how we will implement this solution, so there's an 8-step approach. I'll very quickly run through them. Number one, you have to identify the stakeholders and their interests. To understand their incentives. Number two, to identify the different stages of the value chain for data handling. Number three, then, across each stage, identify the form of engagement for the stakeholder and the consent to taking. So one example would be like a RASI matrix, responsible, accountable, consulted, and informed. And then at each stage, also identify the decision maker, because you have to find the pivots in the system that you have to engage to be able to move forward. And then once you have identified essentially the landscape of all of this, then you can go more in depth and navigate the solution that's needed at each stage, meaning, from a technical perspective, what are the tools that you need to do? How do you balance that with the ethical needs? And this is where collaboration has to happen between the AI technical folks and the domain experts, the health folks. So after you identified the interventions that you need to do, you circle back. This is number 6. You circle back with the decision makers to identify the action item that needs to happen and to implement changes. And then after you have done all of that, you've looked at the different stages, you've looked at the stakeholders, the interventions that are needed and whatnot. You look over that, you observe the trends, and you synthesize the changes that need to happen, and you translate them into policy outcomes. So this is where you're translating process into policy. And then lastly, you want to close the loop to make sure that there's an impact assessment periodically to see how it's going, and also making sure that you're implementing iterative improvements. Now, how will this solution advance the cause? I mean, number one, if we're talking about trust, it starts with clarity. So the fact that with this framework, now there's going to be clarity over the different stages, different stakeholders, who's doing what, what's responsible, that's going to facilitate the center of this, which is the clarity, that then can facilitate the trust. Once you do have trust, then you can hold people accountable, which is number 3. And then number 4 is also because once that, clarity is there, you can facilitate communication. So this is not just to hold people accountable, but to help them and to make their job easy and empower them to make their own jobs easy. So this is facilitating communication tools so that they can always come, speak with each other and via feedback forms, and regular roundtables. So that's what we think that clarity of framework will also facilitate the communication between the stakeholders themselves. So that's where we landed. Back to you, Adriana.
Thank you. That's really great. It's a good model, what you all came up with, I think, from beginning to end, and answering all the questions. I would encourage the other groups to look at this as well, because a lot of times we don't get to the implementation phase. So this is a really good way to think about this. You could see a lot of ideas here that could turn into publications. And again, we'll probably discuss some of this, but I like that you brought up the impact assessment also, which Rohinton brought up, and it would be great to see more of this sort of what people think impact looks like from this space. But really, really good. Thank you. So anyone else have any summaries, anything that you missed you'd like to add on to what's been said? I'll pause for a second. All right, our moderator did such a good job. No need to add anything. So thank you all for the work you've done on here. So what will happen now is we'll have reviewers who review these answers, just like stressing to take good notes, because they'll base their second day on this to really get more in depth into some of these discussions, in case some cases refine the argument and narrow down to a few ideas. So do join us tomorrow for the second day. Again, reviewers will make comments and edits on these documents, as well as a rubric that we'll send out. And then again, that's the opportunity to talk to them again. There are folks who are more established and will be able to give you a little more in-depth knowledge. Yeah, tomorrow we'll start an hour later, 9 a.m. Eastern. Again, we'll continue this conversation, and looking forward to your submissions to the issue. Hopefully this workshop has sparked some ideas, and you all can work on that. Just before closing, I'll call for papers again. Feel free to take a look. It does link from there to the events as well. Again, the webinar is coming up in July. So we encourage you to attend that as well, but hope to see you all back tomorrow. And thanks again for joining today.
Thank you, Adriana. Thanks, everyone. Have a great day.
Thanks, everyone. Bye-bye.
All right, so hi everybody. Thanks for joining us today for the second day of our workshop on digital health futures, organized by the Journal of Science, Policy and Governance in collaboration with the Lancet and Financial Times Commission on Governing Health Futures 2030, Growing Up in a Digital World, or GHFutures 2030 for short. So today we'll continue our conversations in breakout rooms on topics you worked on yesterday. You'll get a chance to review the comments from our reviewers. And I think everyone is already doing this, so make sure you mute your microphone and turn off your video if you're not speaking. So we'll just have the reviewers on here. So I think just for the group to get to know you, I'd like to do a bit of an introduction about who's here, a bit of your background, if you can just briefly introduce yourselves, your name, your current position, policy background, policy expertise, anything you'd like to share. I'm also interested in anything that you observed in the review process that you think would be useful for the group, and then also something that you'd like them to take away from today, which we can also discuss afterwards. So that's all in the chat now, I think. Let me put that again separately. Okay, so just starting with Christian.
Hi, everybody. It's a pleasure to meet you. My name is Christian Franz. I'm running the data and policy analysis company, CPC Analytics, which is based in Berlin, in Germany, and in Pune in India. We have a strong methodological backbone in quantitative data analysis and then policy domain expertise, predominantly in global health and innovation policy, I would say. My personal background is originally, I'm a trained economist. Very soon I dropped that and went more into policy consulting, data analytics, and so that has also significantly shaped my perspective on policy problems. Currently, we're supporting the WHO in building the WHO Hub for Pandemic and Epidemic Intelligence in Berlin, which brings together kind of all our expertise fields as well. So that's a beautiful project, and great to be here and meet all of you.
All right, thank you for that. Any observations from the review? I think we went through that, but do you want to say anything about that?
Yeah, so it was a quite interesting list of points that were touched on, and I also saw that in all the categories there are already elements listed. I personally was a bit surprised to see at the beginning of explaining the background, not so much the opportunity side, but rather the risk side of things, which I appreciate in terms of critical thinking, but I believe in terms of outlining the relevance and why policymakers should look into it. That I think needs a very careful shaping or work. not because I want to be a tech enthusiast, rather it is my experience with policymaking is if you are just raising the potential shortcomings of a new policy or a new structural push, then you end up being not really as successful as providing a clear view on the opportunity and then maybe the red flags to watch out for. So I feel a lot of academic literature takes that privilege of merely criticizing, which I don't want to take away at all. But as this is a very policy-oriented perspective, I think it's important to take into account where will this end up in terms of the reader. So maybe that just as a glimpse into how I would how I looked at particularly the breakout room one that I looked into.
Yeah, very helpful, and that's good to hear. Even for folks who aren't here, if they watch the recording later and sort of think about this. So I'd like to ask that question now. Okay, Bailey.
Yes, good morning, everybody, or afternoon for some. My name is Bailey, and I currently work at the Government of Canada at the Public Health Agency. I'm about to start a new position at the Center for Surveillance and Applied Research, and I currently hold a role on the Vaccine Rollout Task Force by way of the Office of International Affairs. I have policy expertise in the areas of health, environment, and technology governance, and particularly in the area of international surveillance across those three areas. My policy experience spans from civil society to municipal, provincial, and international governance. I've worked at the United Nations, the National Green Party in the 2019 federal election, and city and regional government of Waterloo, and some various postings at the province of Ontario. And I also held an academic fellowship with global affairs at the Government of Canada. At the University of Waterloo, at the Balsillie School, I focused on, for my master's degree, looking at technology governance and feminist foreign policy. And I did a bachelor's degree at the University of Waterloo in environmental science, focusing on the extractive resource industry.
All right, and then any observations on your end from the review?
Yeah, I really appreciate the attention to last mile, and particularly in a post-COVID environment and in the context of emerging communicable diseases and conversations of that happening at the global level. This is an area of increasing focus by the international community. For example, if we're looking at things like cold chain storage for vaccines, or even the proliferation of public health advice to reach communities who may not have direct access to health practitioners within their communities. And I'm really interested to see what could happen if we start thinking about the nuances of implementing some of these policies, such as what instruments would be used. Are we looking at bilateral agreements, multilateral agreements? Are we thinking about developing our own technologies within the project or applying insights from other people's tech systems? And how could this project address privacy and equity concerns, as implementing a new technology in an environment requires definitely strong attention paid to those factors.
All right, very good. Thank you for that. And Kuvili?
Hi, everyone. Good morning, good afternoon, based on where you are. So I'm Kuvili Dasgupta. I am a PhD student currently at the University of Toronto. A little bit about myself is I'm an international student who did her bachelor's and master's in India, and I worked there with the Indian Institute of Science as a project trainee, as well as I was involved in some degree of policy making and student welfare during my stay there. And then I shifted to Canada for my PhD studies, where I started at U of T, and I have been so far very actively been involved in international student affairs. So I served first with the department that I'm enrolled in, which is the Department of Molecular Genetics, and then I moved on, and now I serve with the Dean's Office. So to make policy regarding international students and the general functioning of the university regarding to student affairs. Other than that, I'm also very interested in policymaking, of course, and hence I volunteer with the Canadian Science Policy Center. I did participate in their the Canadian Science Policy Center has an annual conference. So I participated in the 2020 conference and I was an honored participant there. So that's when it all started. That's how I know these folks. In fact, I met Adriana through one of their workshops. And so far, so I have been doing all of that policy making based on how international students fit into the Canadian landscape of work, and also how health and analytics and focus on international collaborations helps bridge the gap between what the Canadian perspective has a shortfall on in terms of talent pool. So that's my background. And based on a few comments on what I have been reviewing, so I was in one of the breakout rooms yesterday, actually the breakout room that I was supposed to review for. So I did have a good discussion there, and I think, in my opinion, there are well-formed thought processes, but one thing that I do see is in the background where they say that there's an inherent lack of trust when it comes to digital health and data access, digital health data. One thing that could be better addressed is how the trust chain functions, for lack of, pardon my terminology. It's so the participants, they bring out a lot about how the government handles the data, how the private sector handles the data, but there is also no focus on how individuals are educated based on data sharing, or how their personal information is taken up and used further. So there are both sides to the process, I think. So one aspect of it is obviously the handling of data once you have it, but the other aspect is also educating the participants on how you give out your information, or what is or not used, what stays and what is dumped out, so that individuals have a better understanding of how the data operates. And that way they have a more of a comfort level in understanding whether they want to participate in the study or not, and which in turn can basically streamline the process of policymaking better, because all stakeholders then know their roles in the entire value chain.
All right, very helpful. Thank you for that background. So we're going to share a few of the documents from yesterday. Again, folks who are here probably have this, but one thing is we do have a rubric also that will ask you to fill that out, because we actually use that for sort of gauging what we accept for the journal. So we're trying to provide a bit of guidance in terms of evaluating that now. So reviewers who are here, please complete that maybe in the breakouts while you're here. Yeah, so I think now we'll take the rest of the time today to split you up into breakout rooms. We'll talk about the second room in a bit, but those of you that are in the same room, so 1 and 3, I think we'll group you together if that works. Hopefully you'll have a good discussion on that. And then we'll come back and recap if that works.
Adriana, would it make more sense just to stay in this room, considering Kuvili doesn't have any other participants?
I'm trying to figure that out. Actually, I think it's fine for now. Quelly, I think you and I can chat. I don't want this to be on.
Absolutely, I'm fine with that as well.
And we can see what to do, but because I emailed some of the participants into, so I'm kind of hoping they'll show up. If not, we can put you there, but I'm going to go ahead and just do that for now.
Thank you to all the reviewers and the moderators. We really appreciate it.
So you all are in your own discussion. I don't want to be part of that either. So I mean, I want you all to have your own kind of discussion where I'm not involved in. So
I'm not joining any the breakout room too. I'm just staying here.
Yeah, so just wait for a second. Okay, Asileta, I think you should be able to go there.
Yeah, I can hear and see everybody.
Christian, you can't hear us?
I can hear you, and I think we lost Asilata.
Okay. All right. Well, yeah, we'll go through this. So thanks to all of you for helping out today. I think even for folks who aren't here, if we can go through and say a few words about the rooms, because I'll send out the recording to everyone. So as I said, it's been a rough weekend for people to join, but I think it's still useful information to share. So yeah, anything from the discussion that stood out, I'm gonna share our accounts again for those of you who are here, but feel free to share with the folks who might be interested. And then, yeah, let's go around and just recap a little bit, anything that you think would be useful for, trainees who are interested in submitting to this issue, thinking through digital health, what they should think about, any kind of lessons learned from yesterday and today. Christian?
Hey, thanks, Adriana. Yeah, sure. I think we could have gone on for a while simply because we are all quite passionate about the topic. I think that the very fact that you're discussing the topic at hand makes a big difference simply because the research by now is substantial on digital health. I'm not saying it's gapless, right? Not at all, but there is a lot out there that can be built on. And certainly the country angle is absolutely vital. Hi, Asilata.
I lost connection and I pretty much missed the last minute or so of the conversation.
No worries.
Yeah,
no worries.
I just saw the chat. Yeah.
Adriana just asked us to reflect a bit on the background on the breakout session. And I think the first comment was just like, discussion helps in a field like digital health that is just as many other fields, heavily researched and a timely one. And the second point is about the very essence of the country background, the country that you're focusing on. Sorry, not the background, but the country you're focusing on is super vital in this field because it's resting. Maybe I refer just back to some of the stuff in the Lancet Commission as well. We have there one chart that looks a bit into, that tries to visualize the kind of digital transformation and what it means for health. And I warmly recommend that as like a framework for, have I covered the different bases for looking at what digital transformation and this specific topic that I'm looking at, have I covered all those angles? Because it is complex and it sometimes helps to go step by step through the layers. So I'm happy to share that, but I think it was shared already. So that's from my side.
Yeah.
Over.
Right. Yeah, I'll share the report again. And as I said yesterday, the call for papers is centered around some of the ideas in the report, so that we're using that for background, as long as some articles that Rohinton shared as well.
Yeah.
So yeah, hopefully we'll have some publications around this. But thank you. Okay, Bailey.
Yes, firstly, I would like to say big thank you to everyone for participating today, and Christian and Kuvili. It was very nice hearing your feedback, and thank you to the student for joining us today, Asilata, if I'm pronouncing that correctly. Just some insights to share across that when I look at a project that's concerned with digital health, what I'm primarily evaluating is how it looks at the right to privacy and how it applies and respects the right to privacy. And I think a big part of that is making sure that informed consent principles are followed, that the local context is understood, and that there's other options for people to access health services without necessarily having to enroll in a digital identification system. And I think There are so many great toolkits that I found in my research as well on the internet that you can find that evaluate impact assessments for health technologies. And it's just looking at the wealth of resources there.
Great, very helpful. Good points. And if you all have any resources that you'd like to share, let us know because we can send them out to participants. And again, folks who are interested in submitting to the call, they always ask for more resources and links. So feel free to send it to me. Yeah. Okay, and Kuvili?
Yeah, first of all, thank you all for joining. It's been a great Sunday morning for me. So I agree to all of the points that Christian and Bailey pointed out, and Asalata, I mean, good for you for having so much insight. It's really nice to see young people participating in that. One thing that I have been harping on since the beginning of this session today is there is obviously a black hole of trust in all of these issues that everybody faces. And especially now that we live in a very interconnected digital world where data privacy in every sphere is a nightmare. It doesn't just matter in respect to your health data. It could be your financial data. It could be your personal information. It could be anything. It could be your gender identity, whatever. So, because, and there is an inherent lack of trust. So my 2 cents would be, yes, keeping in mind all of the points that the other panelists shared, but also identifying the proper stakeholders when it comes to how data is collected, data is stored, data is managed, and data is distributed. So identifying all the stakeholders in the entire chain would be important, not just to frame a policy, but also to identify the different angles of the problem and providing solutions even level to level and not just like going full scale like a policy. Like when you move in from a grassroots level to the upper levels, that's how the food chain builds itself. And having a policy or a law is sort of the tip of the triangle. But identifying these key stakeholders at every level is, in my opinion, the most important part.
Great, very helpful, thank you. And yeah, as I said, we'll be talking about this in the webinars also, so I'll go through that in a second. But Asilata, just to give you a chance to respond to that or any impressions you have.
I noted all the points and I'm very happy. Thank you very much to all the reviewers who took the time to give feedback and also all the resources that have been shared. So Christian, Bailey, Kuvili, and of course, Sharmi, thank you so much for all your inputs. Would it be okay if I could get back to some of you at a later point for help with any of the questions? So Bailey has already shared her LinkedIn with me. So Christian, Kuvili, if you could also share your email or something, I could get in touch with you.
Yeah, I think my LinkedIn is there previously, like Julianne shared, but I will also give you my email.
Sure.
Yeah, very helpful. And we'll send out the emails. And we usually say this too. Obviously, would welcome your publication submission, but also we encourage people to work with others who are in the room with them. So sometimes that happens that they're sort of create groups and submit the paper together, that sort of thing. So I'm happy to share emails from other folks too. If you'd like to write together or just by yourself is fine too. Yeah.
Sure. Thank you so much.
You've gotten a lot of good knowledge here. Yeah. Very good. Okay, so to wrap up, just want to remind you of the webinars that are coming up. So let me send you again the link to the events. So July 1st, we'll talk about the role of digital technologies as determinants of health, again, which we discussed here. Some background on this, again, this will be focused on how digital transformations or lack of are affecting all ages and all areas of life, particularly health. Talking about scaling up investments in health and education, overcoming digital and health divides, and also training the current and future health workforce in this webinar, again, to think through how we can ensure sustainable health futures. And the next will be July 15th. We'll talk about governing health data to increase public trust, public value, and foster trust, again, which we'll discuss today. More focused on policy developments to promote human rights in the digital environment, involve youth in designing health policies, and also unlocking the shared public value of health data while increasing trust. So the events are being planned right now. We're in the last phases of confirming the speaker. So I think it'll be a great conversation. Again, we're inviting sort of leaders in the field. And this, again, was just sort of a initial discussion on these issues. We'll share the recording with Rohinton as well. I encourage you to watch that too. And hope to see you all at the webinars as well. So that's it from me. Whitney, I don't know if you want to say anything else before we close.
No, that's all good for me. Thank you, Adriana. Thank you, everybody, for coming. And I hope it was great for you as well. And we look forward to the webinars.
All right. Thank you all. Thanks again for joining, and to our moderators and reviewers, and enjoy the rest of your weekend. Thank you.
Bye-bye. Take care.
Thank you.
Bye, everyone.